Hello everyone. Today we will discuss about cerebral stroke. Cerebral stroke is one of the commonest complication of atrial fibrillation. In my previous video, I have already discussed about atrial fibrillation. So in this video, I will discuss about cerebral stroke due to atrial fibrillation. A female patient came to me in Agra. She was 83 years old and she had the symptoms. She presented herself with the symptoms of right-sided hemiplegia, facial paralysis, right-sided, and due to this facial paralysis, she was having difficulty in speaking, difficult speech, and with blurred vision and dizziness. So with these symptoms, that patient she presented herself, and these are the symptoms of cerebral stroke. And the most important thing in cerebral stroke, in the treatment of cerebral stroke, which is required, that is time. With each passing time, with each passing second of the stroke, with each passing second, the stroke goes untreated. The neurons of the brain are getting damaged. So the most important thing to remember in cerebral stroke is time. This patient was immediately brought to the hospital by her family members when her stroke symptoms developed, and in these kind of cases we should prescribe the patient thrombolysin. Thrombolysin immediately when the patient develops the stroke. Thrombolysin will save the life of that patient. And I will discuss about this thrombolysin at the end of the video. And after that patient, she got admitted to our hospital. We thoroughly interrogated with her family members, and her family members, they narrated all the symptoms of uh, atrial fibrillation, which the patient was uh, experiencing since 1.5 years, since 1 or 1.5 years. And after this, we asked the patient to go for uh, a ECG and CT scan of the brain. Her ECG reveals atrial fibrillation, and the CT scan of her brain, it reveals the hyperdense hyperdense of her left middle cerebral artery. And And this hyperdensity of the middle cerebral artery of left sided, it occurs because of thrombosis which developed or which was caused due to atrial fibrillation. So now we will study the pathology of cerebral stroke due to atrial fibrillation. So the pathology, that how atrial fibrillation is responsible to develop cerebral stroke. So what happen is when atrial fibrillation develops, it affects the heart's ability to contract. Affects heart's ability to contract. So due to this, the atrium are not completely emptying the blood into the ventricles. Emptying blood the complete emptying of the blood into the ventricles is not done in cases of atrial fibrillation. So this results in pooling of blood in the atrium. So when time passes after a time period, it this pooling of blood it develops into atherosclerosis. And due to atherosclerosis, the blood pressure in the arteries they increases, and this atherosclerosis a plaque in the arteries form, and which leads to increased blood pressure in the arteries. And due to increased blood pressure, uh, a small piece of this plaque is carried away by the blood from the left common carotid artery uh, to one of its branches, that is internal carotid artery. And this small piece of that plaque goes it enters into the middle cerebral artery. And when this small piece of that plaque, which is known as the thrombus, when this thrombus enters into the middle cerebral artery, it then it develops all the signs of the stroke. So in CT scan, we can uh, clearly appreciate. So in CT scan, we can clearly appreciate the uh, ischemic lesion or the hyperdense lesion in the middle cerebral artery, which is responsible for uh, developing ischemia in the brain. So this was the pathology of the stroke due to atrial fibrillation. So now we will move towards the homeopathic management in cases of stroke. So in these homeopathic management. So in these kind of cases, we should prescribe immediately arnica montana Arnica montana in 1 potency, and it should be prescribed single dose because it works as a thrombolysin. Thrombolysin means a kind of medicine that will uh, dissolve the thrombus. So Arnica montana in it works wonders in cases of ischemic stroke. And the second homeopathic medicine we can prescribe is oleander. Oleander, it works wonders in cases of hemiplegia. Irrespective of any side, left or right, we can prescribe oleander. There is one more medicine for hemiplegia, and that is xanthozylum. Xanthozylum fraxinium. Uh, it is for paralysis, that is hemiplegia, and mainly left side. So this was all about cerebral stroke due to atrial fibrillation. Thank you.